Hi, my name is Hegyi, and the purpose of this video is to demonstrate an easy yet accurate method of making alginate impressions in stone cast. It is intended primarily for students of the physiologically driven treatment system and the data appliance, but it's also intended for anyone who's interested in making better alginate impressions. You know, in this day of intraoral scanning and digital impressioning, many of our conventional impression techniques seem to be falling by the wayside. However, there's continuing to be a high demand for accurate alginate impressions. Alginate impressions will be continuing to be in dentistry for many, many years to come, and largely because of some of the unique qualities of them. And those qualities are, first of all, they are by far the most inexpensive impressions for us to make. Secondly, they have a quality of being hydrophilic, which makes it an excellent impression medium for taking impressions in the mouth, considering the saliva and other fluids that are present. Third, they happen to be a very, very, very accurate impression medium. Used properly, using the methods and materials we're going to demonstrate today, they make an extremely accurate alginate impression. And finally, they allow us to make impressions and cast almost immediately. We can take an alginate impression, pour it, and have a very acceptable model or cast within a matter of minutes or hours, depending upon the stone we use. So with that being said, what are appropriate applications for alginate impressions? Well, in my office, we use them for 5 distinct reasons. First, we use them for opposing casts for our crown and bridge procedures. Secondly, we use them to fabricate our bleach trays, our vital bleach trays. Third, we use them for making our preliminary impressions for our full upper and lower dentures. Next, we use them for our final impressions for our removable partial dentures. And as you know, to make removable partial denture frameworks requires a tremendous amount of accuracy. And then finally, and probably our most common use, is we use them for diagnostic study casts. And that might not sound like a very demanding requirement, but used in context with the physiologically driven treatment system and the verification requirements there, you know, we need to know that those casts represent the reality, that they represent what's really going on in that patient's mouth. And fortunately, using the methods and materials we're going to demonstrate today, they certainly fulfill that requirement. Now, before we get started, I would like to acknowledge a couple of people who have contributed to this presentation. First of all is Gordon Christensen. Secondly is my friend, the late Tom Abrahamson, Dr. Tom Abrahamson, both of whom have DVDs on these topics, and they will be referenced actually in the very end of this video. I highly encourage you to purchase these DVDs and watch them. There's a lot of supplemental things that we're not going to cover today that they cover in those DVDs. And so before we get started, I hope you enjoy this. I hope this is very helpful for you, and most importantly, I hope it's helpful for your patients. Thank you. Before we get started with the actual methods and techniques involved with our procedure today in the video, I'd like to cover some of the most common myths regarding alginate impressions. There are many, many myths and misunderstandings about both the impression material itself as well as how it should be utilized. And many of these topics will be covered as we go through the procedures shortly in this video. But there are 3 that are very specific to the methods and materials we're going to demonstrate today. One specific set of materials and methods. And with that in mind, there are 3 very important misconceptions that we need to cover because they're kind of at the foundation of this method that we're going to describe. First of all is the idea that the water-powder ratio somehow affects the accuracy of the impression. And that's absolutely false. And that's a fundamentally important thing because we understand that the water-powder ratio only affects the viscosity of the alginate mix and also the setting time. And we're going to use that to our advantage because we're going to control the viscosity of our alginate impressions to an optimum for tissue control, for tissue displacement, and very easily being able to capture our details of our occlusal surfaces of our teeth. The second misconception is that the water temperature affects the accuracy. Once again, this is a myth. The water temperature really only affects the setting time. And we're also going to use that to control our setting time. You know, we're going to talk about having control over our viscosities, our setting times, and we're going to use the water temperature to control one of those variables. And then finally, we're going to talk about the importance of the interaction between the alginates and stones. You know, there are dozens of brands of stones, there are dozens of brands and types of alginates. And what we find is even though individually they may be very excellent, in combination they don't work very well. So we're going to discuss one specific combination of stone and alginate. And it was actually introduced to me by my late friend, Dr. Tom Abrahamson. And I was showing him some of my casts a few years ago. And he looked at me and said, "Carl, those look pretty good, but try doing this. Try using this stone and alginate mixture." And I did, and when I changed, I was amazed at how much greater the detail was and the accuracy was. And you'll see as we go through the video, and we'll demonstrate, you'll actually be able to see some of the casts that we've made in high detail. I think you'll be surprised how accurate and detailed they really are. Hi again. Before we get into our actual demonstrations of our procedures, I'd like to review with you some of the important materials that we're going to be using and demonstrating. And this is not a comprehensive list or demonstration, but it will show some of the important materials that we use. Now, first of all, we begin with our impression trays. And we're going to be demonstrating today, for reasons that I'll describe as we go along, a water pick. They're called master impression trays, a disposable tray. And the important qualities of these trays is, first of all, that they are rigid. We certainly want a rigid tray. But secondly, and something you probably haven't thought about a lot, we can modify these trays. And not only by border molding, but we can modify the shape by heating and molding, so we can make kind of a semi-custom impression tray. These are excellent, and we'll be demonstrating their use and their modification shortly here. Next, we have our actual impression material, the Alginate, and we're using the gel tray regular set. And again, you can use a number of different types of Alginates. There are many brands available. This I have found, number one, in and of itself is an excellent, accurate material. Gives great detail, but also works very, very well and compatible with our stone, which we'll be showing now. So our stone itself, we're recommending use of Co-Cal Buff Type 3 stone. Again, this stone, again, in and of itself is an excellent material, but more importantly even, it's highly compatible with the gel tray regular set Alginate. And that was a quality I didn't really appreciate until I was told about that by my late friend, Dr. Tom Abrahamson, when he made me aware of just what a difference it made. And when I tried different combinations of stones and different Alginates, it was amazing how much more detail and how much more accurate these two proved to be. So that combination of the Co-Cal Type 3 buff stone with the gel tray regular set is a great material, great combination. Next, we have our material, our tray adhesive. This is Bosworth tack. You can also use hold, but some type of a tray adhesive. We need to understand and appreciate that even with the perforated trays we have here, we can't rely on these perforations to retain the impressions. When we take the impressions the way we're going to be showing, when we inject into the vestibules and we get a really good suction of those trays, when we're trying to withdraw them, oftentimes if we don't use the hold or some type of a tray adhesive, we'll find there's actually a separation and then distortion of the impression. So I highly recommend and will demonstrate the use of this. Again, this is tack, but you can also use hold. Next, we have a product that was actually introduced to me by my late friend, Dr. Hud Heidorf. And this is a material called Wonderfill, and it's a great material for filling tongue spaces. Or if you have voids in your impressions, it's a great filler material. And it works much better than Play-Doh or other kids types of dough materials. This works much better. It's very reasonably priced. Highly recommend its use. And then finally, a material that's not in its original container, but it's a material called tack. This is a thermoplastic that can be heated and molded, and we use it for border molding. Now, with the methods we describe, we don't very oftentimes need to border mold for reasons we'll try to tell you about shortly here. But if we do, this is a very, very nice material for border molding, and we'll demonstrate its use also. Okay, in our procedures section, the very first thing we want to start with is our tray selection. And we already described briefly that, again, we use the water thick impression tray, the disposable trays, and largely because, number one, they're rigid. It's a rigid material, but also something I'd like to demonstrate to you here is the fact that they're easily modified. And that's really an important quality. You know, we can take, if we use a metal tray, certainly metal trays are wonderful, but you can't change them. You really can't modify them other than adding on to them by border molding. With these trays, we can actually modify the shape. And I will tell you that routinely, 90% of the time, I'm going to do the exact modification I'm going to demonstrate to you here. The actual modification will only take place after we've inspected the patient's mouth, which will be in our next procedural section here. But let me show you just briefly here how we actually do modify the tray. We use one of these. In this case, I'm using a blazer torch. You can also buy inexpensive torches like at Bed Bath & Beyond, but some type of a butane or propane type of torch here. And we'll just very simply go around the periphery of the tray. And this is something I will almost do routinely. What I'm doing here, so as much as I like these trays, I typically find that to get the border molding and to get the soft tissue and vestibule form I like, I need to modify them. So I'll heat them, and as you can see here, it becomes kind of pliable. And typically I will take that labial portion, bring it back a little bit and widen. And how much I will widen will obviously depend upon the patient's situation. Do they have exostoses, tuberosities, tori, whatever. But we'll modify that, and then we'll just cool it off in the water. And then we'll take this again to the patient's mouth, verify that we have adequate room. But we'll do whatever modifications we need to this way in almost every case. Now in the lower, very similar. We're going to heat the labial, but in this case we're going to heat both the facial portion and the lingual. And I will tell you that what I'm doing here on this tray we'll probably actually end up using these exact trays on our demonstration patient. So we'll heat those peripheries, and we'll typically widen, bring the labial portion forward, and then I'll also bring the lingual portion, if you can see that, and like that. So that's typically how I modify that tray. And then once it's modified, we'll run under cool water, and there we'll have it. And if we look at that, if we can take a break here, I'll show you a comparison of this to an unmodified tray. And here we see the results of the modifications we made in the trays in our previous segment. And you'll see on your left-hand side, you will see the original trays unmodified. And on the right-hand side here, we'll see the modifications we made. Now this is just kind of a generic modification we've made. And again, this is what I just demonstrated to you a few moments ago. And we will do this actually routinely on our trays as they come in. These modifications seem to be a good starting point for us to customize in the patient's mouth. Ultimately, the actual shape that we will use in the patient's mouth will be dependent upon the patient's anatomy, certainly. Now, if we form the trays we described, modify the trays as we described earlier, and also if we use the recommended viscosities of alginate, which we'll be demonstrating shortly here, what I'm going to demonstrate here now is really not very often necessary, and that's called custom border molding. And we have two types of materials we can use. One is a soft and one is a rigid type of border molding. One of the things we need to understand about border molding is that if we're using a soft material, we're going to demonstrate the use of a utility wax, we need to understand there is a potential for distortion. When that impression is removed from the mouth, because of that wax being not rigid, if that happens to be bent a little bit, it can certainly distort the impression. So if we're really concerned with having very, very accurate details of those areas that we are border molding, we're going to want to use the rigid material, the tack, which we'll demonstrate here. Now, where common implications or common applications where this will be necessary, frequently it'll be done when we have third molars. When you need to extend those trays, when you have those really like dolichocephalic types of arches, they're really long, you just need to extend those trays a little longer. Occasionally, some patients with extremely deep vestibules will want to do some extensions there. However, using the alginate in the manner we're going to show you really does not require vestibular extension very frequently. But let's show you how it's done just in case you want to do it. First of all, we use the wax, we use our utility wax, and here we're just literally going to extend. We're going to extend wherever we need to extend the tray to get the coverage that we want. And again, this would be probably the most common application of that, where we're extending to accommodate the length of the arch for third molars. And understanding that by use of a wax, it's relatively accurate, it may be very accurate, but because it is a non-rigid material, we need to understand that there may be some distortion. So we're going to add wherever is appropriate to get the trays extended, and then we can actually take this to the patient's mouth, and I'm not going to demonstrate that here. We can take it to the patient's mouth and then verify that it's covering what we need to. And of course, after that's done, we're going to again spray the tray with either hold or tack material for the adhesive. Now, the use of the rigid material, which is going to be much more accurate, we're going to demonstrate the use of this material called tack. And tack, as you can see here, comes in these little, again, it's a thermoplastic that comes in these little white beads. When you put it into heat, and this is nothing more than a coffee pot here, when we do that, the material comes out, it turns clear, and becomes very pliable. And it's a very nice, kind of almost, as you can see, a very sticky material. And we can take that material, and we can border mold as we need. And I'm being very, very, very generous in the molding here. And we'll trim that down. And this stuff is very, very, very sticky, as I think you can kind of get a sense of here. And it's actually sticking to my gloves. We can take this, we can put it back into the water. Okay, so here we are ready to take our impression. And the first thing we're going to do is a visual inspection of the mouth. And that I'm going to do actually with my loops on. I'm going to get, I don't know if I'm in focus here or in the picture, but I'm going to do a visual inspection. We're looking here first of all to see, is there debris? Has the patient just recently cleaned their teeth? Do we have a lot of debris in there? Does she need to go brush her teeth? And secondly, we're going to be looking, feeling here. Does she have any tori? Does she have any exostoses here? Just to get a sense of what size tray we're going to need to use. And again, Debbie here, who has been an assistant of mine for many years, looks pretty clean. We've done many impressions on Debbie before. She's a great subject and a great sport with doing this. And thank you, I mean this, thank you very, very, very much. So again, after doing this, what we're then going to do is to do the tray modification that we demonstrated in the previous segment. And we've done that, and I'm going to take the trays, and I've already done that, and I'm going to check them in, and what I want to see here is do they extend distally far enough, make sure it looks good there. I'm going to get a sense of the vestibular extension, although as you will see, with the viscosity of alginate we use, it's very forgiving on the vestibular extension. But also I want to see, are we too tight? Or, we want about 1/4 inch of room all around. And so how do I do that? Very scientific here. We just kind of feel. I can feel there's play around the whole tray, not too much, but it's not like binding. So I'm comfortable that's the proper size tray for the lower. And then we'll repeat that same process for the upper. And relax your upper lip over that, making sure we have adequate coverage, which looks good. And I can feel with the tray, you have a little bit of room there. So that feels good. So I think we have good sized trays. And so with that, the last thing we'll do before actually making the impressions, we're going to have the patient rinse out. And we're going to have them rinse with an alcohol-based mouth rinse. And then it's just to remove any little bits of particles of debris or food. I like an alcohol-based because it's lipid soluble. If the patient has had something like, they had a piece of bacon before they came in, it'll eliminate any of the grease or whatever that might be in there. But you can use whatever. But the main thing here is just to remove any fine particles of food that might be remaining. And that's it. And with that, we're ready to make the impression. Okay, I'd like to talk a little bit about, actually quite a bit about the alginate. The alginate is really what this whole video is about. And a lot of little details, a lot of little important details to cover in this portion of the presentation, this part of the technique portion. In any event, the first thing we're going to talk about is the fact that, as we alluded to earlier, we're going to use 2 viscosities of alginate impression. Very, very, very important. This is the one area, where as clinicians we are taught to follow the manufacturer's instructions. Well, this is one area where I'm going to very much disagree, because we're going to modify the alginate to our likings, to our specifications, so we can get the desired viscosity and setting times that we want for the accurate impressions that we want to get. Now, that idea really came about as a result of using 2 viscosities from Ivoclar, Debunking, and you can still get these. If you would rather use these materials than the gel trait regular set, it's their system 2, which has a low viscosity and a high viscosity mixture. That's where the idea came from. And those are about $3.50 a piece. And it's a wonderful material. Personally, we use gel trait. And I use a gel trait regular set because we love the detail. We also like the fact that it's a lot less expensive. We can make these impressions for about $1.50 a piece. And I'm also able to adjust the volume of powder and liquid to exactly the viscosities that I want. And what, from my experience and my starting point is we have 2 mixtures. Our low viscosity is going to have 12 grams of powder and 35 milliliters of water. Our high viscosity or tray material is going to have 26 grams of powder, of alginate powder, and about 62 milliliters of water. Now, I would recommend trying that as a starting point. And these numbers are, again, I referenced at the end of the video, so you don't have to worry about writing them down. But I would begin starting there. And if you like, you can modify them. And remember, the important part about the water-powder ratio is strictly, from our standpoint, is to control the viscosities that we want to achieve. Viscosities that allow us to get really good impressions of the occlusal tables and the interproximal portions of the teeth, and to get very nice border molding and border extensions for the soft tissue areas. Now, how do we do that? Well, again, I'd recommend these. We have a little scale got from Bed Bath & Beyond for weighing out our alginate, and all this stuff is pre-measured. We have here our water volume measure, and we use that just to determine, first of all, that it's the appropriate amount. But what I've done, I've actually, to make things easy, I believe that consistency and predictability in virtually anything we do are a wonderful quality. And to try to make things as easy as possible. And one of the things we do, first of all, is we go ahead and pre-measure all the powders. And again, those powders are measured on these little scales. And so we know we have precise measurement. If you rely on the volume of powder measurement, which is what's recommended on the gel tray can, you're going to have very inconsistent measurements. You're going to find if you were to actually, scoop them out and have 2 different assistants doing it, and over different times, you'd be very surprised at how much variation you're going to have in the actual amount of alginate there. Now, from the water standpoint, again, we determined that and measured this. What I did, to make it even easier, I took these water measures, these water scoops, and to make it kind of as easy as possible, I have pre-cut these to exactly the amounts we want. So the assistant doesn't have to do any measuring. All she has to do is literally scoop out the water, pour it in, and we're going to have a very, very consistent mixture. Now, the next thing that's important, again, from the standpoint of our consistency, is our setting time. And again, the setting time we're going to control by the water temperature. Now, what we use is we have one of those old hand-on water baths, and we have it set at 30 degrees Celsius, which is about 87 degrees Fahrenheit. And we found that temperature with these water powder ratios gives us a very nice working time. It gives us enough time to get in and do what we need to do, and you'll not be waiting and waiting and waiting either. Again, my recommendation to you is start with the measurements we're giving you here. Try them yourself. If you want to vary, if you want to set a little faster, raise the temperature. If you want a little more working time, lower the temperature. If you want to increase or change the viscosity, you can adjust. But these are, I will tell you from lots and lots of years of experience, these are very good working ratios. And this is where we really want to begin. And so with that, we would like to move forward into our next segment and actually show making the impressions. Okay, now that we have the tray properly fitted for the patient's mouth is cleaned and ready for the impression. Now we begin the process of actually mixing the alginate. Beforehand, a couple quick words about that. There are different ways of mixing alginate. There are alginators, there's hand mixing, and that's really up to the individual. I find with my assistants, they do a wonderful and consistent job by hand mixing. If you want to use an alginator or whatever kind of mechanical devices you need in addition, you feel welcome to. We're going to demonstrate just using a manual process. Now the first thing, as we described earlier, we're going to want to apply adhesive to the tray. And that is to assure that we don't have any separation of the alginate from the tray during the removal of the impression. Next, we have already pre-measured our powder, our alginate mixtures, for the low viscosity and the high viscosities. And we have in the back, which you may or may not have, is our little water bath, which keeps our water at a consistent 30 degrees centigrade. And again, you can use whatever temperature you want, but again, we find that that's a nice temperature that gives us a setting time that's very comfortable to work with. And if she's now, Donna's going to use our little pre-measured cup so that we're going to have exactly the same amount of water each time and get our nice consistent mix. And the smaller cup is actually for the low viscosity, and the large cup is for the high viscosity. With that done, she's going to go ahead and mix. And while she's mixing, I'm going to make a comment here. Something else we did not talk about, which you'll see there, is a 35 milliliter syringe. And those trays are very readily available. I get mine actually on Amazon. They're very inexpensive. But that syringe is what we're going to actually use to syringe the material into the patient's mouth, which we'll demonstrate in our next segment. So she's mixing. The most important thing here, of course, is to have a nice, smooth, homogeneous mix. And again, with the working time we have, with the water temperature, this does a nice job. Now, if she is working with me, as we will do in the demonstration, after she fills that, she's going to hand that to me. If she's working by herself, she's going to very simply, as she will show here, load the syringe and set that aside, and then mix the high viscosity. And again, the high viscosity alginate will be loaded into the tray. And again, having a nice smooth mixture here is very, very, very important. And again, using the same consistent water powder ratios produces a very consistent and very predictable mix, a very consistent viscosity, and the temperature produces a very consistent, good working time, good setting time. So she will then load the tray, and we are now ready for insertion into the patient's mouth. Okay, with all preparation work done, we're going to get started on taking our upper impression. Some discussion is whether you start with the upper or lower. I prefer the upper. It's certainly a personal thing. I like to get the more difficult impression for the patient over with, but it's really up to the individual. Now, as I'm speaking, Donna's over there mixing the low viscosity material for the injection into the 35 milliliter syringe. And although we don't normally do this, or typically do this, patients who are very, very wet, we actually do this more on the lower than the upper. We'll put a little bit of a 2x2 gauze in there and just kind of absorb, so we're not in a pool of water. So as I'm speaking, Donna's loading the syringe with the low viscosity alginate. When she's done, she's going to hand that to me, and I'm going to wait a little bit until Donna's about halfway through the mix. Now, if I were mixing this, or if Donna were taking these impressions by herself, or making these impressions by herself, she would just set this down. We have plenty enough working time here. Okay, with that, we're going to begin injecting. And we're going to inject starting in the buccal vestibule, starting in the most posterior area, trying to be continuous here, trying not to have any interruption of the material so we don't have bubbles or voids in there. We come all the way around there, and then we come up on the occlusal surface. And I'm actually going to try to come around a little bit on the lingual. And now what are we going to do? We're going to wipe, wipe, wipe. And this is where I get messy here. But we sacrifice a little bit of neatness for accuracy and detail. So I'm making sure we have not just the occlusal table, but also the buccal and labial aspects of the teeth. And then I'm going to use the last little bit to go one more time, go into the vestibules. Set that aside. Donna then hands to me the high viscosity material. And then insert that. And Debbie, if you could please wrap your upper lip around that tray. Great. If you have the patient help you a little bit. Now, if you could lean your head forward a little bit. Wonderful. Now, right now what I'm doing is I'm border molding. Are you doing okay there? You doing all right? Pardon me for making a little mess here. Now, if a patient is a moderate gagger, here we'll instruct the patient to breathe through their nose. And actually tell them to actually focus. Think about breathing through your nose, Debbie. Okay, a little louder so I can actually hear you. And that seems to be very helpful. For those patients who are even more severe gaggers, as strange as it might sound, what we found that's very helpful is to actually have them raise one of their legs. We'll actually have them straighten their knee and then actually raise their right or left leg off of the chair. And that distraction seems to be very, very effective. We have never really had, we do a lot of impressions, a lot of Alginates, we have never had a patient that we couldn't overcome with the combination of those two procedures. And so right now, we're just waiting for everything to set. And again, if we wanted to, actually the water's been cooling down a little bit doing this video because we don't have it plugged in, so it's going to probably take a little longer. But with our water, again, measured out at 30 degrees centigrade, this impression would have been set already.
That's good.
Okay, now we're going to withdraw. Now again, typically these have a lot of suction, and sometimes they're hard or difficult to get out. And try to do it in a snap, a quick snap. Okay, good. And if we look here, I'll set this aside here. And then we'll give the patient a little napkin here they already have. And as messy as that seems, that's probably neater than I usually am. I'm usually pretty messy. And with that, let's take a quick look at the impression itself. Okay, we're now ready for the lower arch impression. Making the lower arch impression is very similar to the upper arch, with a little variation in the actual injection, because now we have not just the buccal vestibule, but we have the sublingual areas. Otherwise, it's pretty much the same, other than you don't have to deal with gagging, and kind of gravity is kind of working on our side here instead of against us. So, as we're speaking here, Donna's mixing the low viscosity injection alginate and loading the tray. And again, if Debbie were very, very wet, very juicy, so we speak, we would also have the cotton in there. But she's not. I mean, she's very typical, and because of the hydrophilic nature of alginate, you know, unless someone is really, really juicy, that's really not necessary. So we have the injection ready here, and in just a few moments after Donna's about halfway through mixing the high viscosity, lower takes a little longer to inject, so I'm going to go ahead and begin. And we're beginning the buccal vestibule, starting most posteriorly, coming around, and now curl your tongue back. Great. We'll get the sublingual areas. And then it kind of overflows, but we'll go on the occlusal table here. And then once again, we're going to wipe, 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 wipe. I'm trying to wipe not just into the occlusal tables, but also I like to get those gingival areas, the whole lingual buccal contours of the whole tooth. And we then load the tray in, tongue up to the roof of your mouth. Seat the tray anteriorly first. Stick your tongue way out. Wiggle your tongue. Great. Kind of border molding the lingual area. Can you wrap your lip over the front of that? Good. Yeah, the patient kind of bring your lip again up over the lower tray. Good. We'll kind of border mold this as we're going. Stick your tongue way out again. Way out. Great. Wiggle it again. Good.
That should be good.
Okay. And once again, try to remove the tray with a quick snap. Okay, great. Again, take a little, get an idea of the impression. Okay, and we'll show close-ups of these. You can see very, very nice border extension, maybe a little overextended here on the buccal portions, but very nice. And we'll go ahead and get these poured up, and then we'll talk about that, and then we'll take a look at the final results afterwards. Okay, now that we have an accurate impression, what do we need to do to assure, or to ensure rather, that the cast that we make from this impression retain that accuracy, that we have accurate cast, because ultimately that's what it's about. It's not the impression, it's the ultimate cast. And so here we have Debbie's lower arch impression, as you can see here. And the first thing that comes into consideration is what are we going to do as far as moisture control? Because we understand that alginate is very able to absorb a lot of water. So we first of all, we want to rinse the material off, any debris that might be on there. Again, if you do the swishing that we described and showed, really what you have debris, but first of all, if there is, we will rinse it off under the tap. And we'll kind of shake off the excess and blow off a little bit. So we want it wet, we want to dry it out, but we don't want there to be, you know, pools of water in that. Now the next question becomes one then, well, what are we going to do about disinfection? And disinfection is a very controversial subject. We all understand and appreciate the importance of disinfection, and yet we're also concerned about the accuracy of our impressions. And what we understand and what research has shown is that any form of disinfection that's done effectively has the potential to either chemically react with or to alter the form, the shape, the accuracy of the impression by imbibition. And so what do we do? Well, I personally, and this is a personal decision for you, I do not disinfect my impressions. I do disinfect the cast after the impressions are poured, and I will use a 70% ethyl alcohol containing disinfectant. But I personally do not disinfect the actual impression itself. Again, for you, it's a personal decision, and certainly if you don't disinfect the impression needs to be handled appropriately through the process of pouring. But anyways, with that, the next question becomes one then of how do we store this, and how long can we store this before actually pouring? Well, different impression materials, different alginate brands have different times before they begin to distort. My personal rule with the gel tray in our office is 10 minutes. And that may sound impossible or impractical. We really stick to that rule. I will tell you that, I would certainly recommend not going over a half an hour. And nothing you can do to assure that the impression does not either shrink from dehydrating or expand from imbibition is to keep it in a humid, neutral or humid area of storage. And what we do is we use these little sandwich bags, these little Ziploc bags with a cotton roll saturated with water. We will place the impression into that bag. I don't even completely seal the bag off. I will kind of put it in there, and then I will store it on our little impression tree here. And then we'll then take this to the lab, and we'll then go to the pouring stage of the impression. Okay, now let's pour an excellent impression here. And as we described earlier, our recommendation is to use the Cocal Type 3 buff stone. And for two reasons. One, because individually it's an excellent material, excellent stone. And secondly, because of its high compatibility with our alginate, the gel trait regular set. And so for that reason, we are going to use the Cocal, again, Type 3 buff stone. Now, unlike our recommendations with the alginate, which were to make our own custom water powder ratios, the opposite is true for the stone. Here we're going to want to have very stringent regulation of the water powder ratio by manufacturer's recommendations. And so what we do for the purposes of consistency and also of ease, we will go ahead and pre-measure. We will pre-measure, and we will use 150 grams of the powder, of the stone itself, and with pre-measured 45 milliliters of water. And that gives us, that is manufacturer's recommendation. Now, if at all possible, we highly recommend using a vacuum mixer, which we're going to be using and demonstrating today. If by some chance you don't have access to one, what I would recommend is still use that same water powder ratio, but when you have your stone mixed, take it on the vibrator, put the vibrator on high, and let that vibrate out a lot of the bubbles. You can still remove a lot of the bubbles with that. But let's use the vacuum mixer. So we're going to start with our water, 45 milliliters of water. And to that we're going to add, and these, by the way, these are urine specimen cups. And I promise you these are not used. We got these new from a local drugstore, and they're perfect for holding just the right amount of stone. If you fill it up completely. But again, we still do pre-measure and weigh it out. But it's 150 grams of stone. We're going to go ahead then and pre-mix this, because the vacuum mixer is not so much to mix as it is to remove, it does mix, but also primarily to remove the bubbles from it. So we'll get pretty much the stone and water incorporated. We will then take it to the vacuum mixer here, and we will let that go for 30 seconds, during which time I will turn the vibrator on. For a little bit there. Now, before actually pouring the gas, I do like to give it one or two shots of the debubbleizer, the curd debubbleizer, which is surfactant, prevents any bubbles. We'll turn that off now. And my personal preference for pouring impressions, I like to start at one corner. I like to start at one corner, one posterior corner, and I like to watch the stone advance. And as it does so, we will see that it will create a little pool of that debubbleizer that we sprayed in. We don't want to incorporate that into the stone mixture. And as you will see, if you can get that, as it comes off the end here, you'll see a little bit probably drip off there. A little bit of that excess dripped off right there. Okay, once we have that, now we're going to go finish pouring. Again, nice thing with this blower, with the Wonderfill, the tongue space, it really makes pouring this so very much easier. We're going to get that roughly filled there. Now, contrary to what some individuals say, they say you should never invert an impression. Well, I can tell you I've inverted impressions for 35 years, and I've never had a problem or any kind of distortion as a result of it. Again, you can do as you like. I'm just sharing with you what I personally do. And we'll form a little bit of a base here. And we will invert the impression on that. Neaten that up a little bit. And there we have it, and there we'll let it set. And we'll take a look at that after it sets. I'd like to begin by thanking you for joining us for this presentation. I hope you've all learned something as a result of this, especially my students in the physiologically driven treatment system and data appliances. I really would like you to apply these principles of impression making to the impressions you use to make your data appliances to begin with. And for all the rest of you, I just hope you've learned something. Stay tuned to the end of this conclusion of this video portion, and I have there's some references for you, a materials list, just some key points you might want to keep in mind, and just some of the water powder ratios we recommended. Once again, I thank you, and I hope this helps you, and most importantly, again, I hope it helps all of our patients. Thank you.